So I'll do that afterwards. Then I'll call out to you.
Okay, great. Thanks, Tracy.
Just a reminder to everyone, we are recording the session. It's just so that for people that were unable to join us from members that may want the update later.
Morning, Mayor Taylor.
Oh,
He's down in the bottom. Well, on my screen anyway.
yeah, no, my screen too. I feel like romper room. And there's Lynn Ford beside John Taylor. Oh, wait, I think I just aged myself. Whatever.
Then I shouldn't have laughed and agreed because I did too.
And I'll claim to have picked that up.
So did I. We all did.
This year I became eligible to join the senior center. So how's that for aging yourself?
There you go.
And you can't even go because it's closed.
That's right.
You can also get a discount at Shoppers now,
Yeah, wow. Okay, I'm in.
I think. Okay, Kyle, we are at 8:32. So even though Tyler will continue to admit people, I think we should get started.
Sure.
So I will turn it over to our new chair of the board, Kyle Burgess.
Wonderful. Thank you very much, Tracy. Good morning, everybody. Thank you for joining us for this very important meeting we have. My name is Kyle Burgess. As Tracy said, I'm the chair of the Newmarket Chamber of Commerce and a senior employment lawyer with Minkin Employment Lawyers. Our speakers today have to be off the call just after 9 a.m. as Tracy said before we started recording. So we're going to dive right into starting with Mayor Taylor and then hearing from Dr. Genesove with the York Region Public Health, and Zara Kassam, Director of York Region Healthy Living and the COVID-19 Operations Chief for the region's Health Emergency Operations Center. When they've all given their comments, we will open it up for questions as we normally do. If you want to put the questions that you have in the chat box, we will draw from these if time permits. Tracy, the Chamber President and CEO, will take over for the Q&A, and we will have some additional updates from the Minister, from Minister Elliott's office and the Chamber also as well following our guest speakers. Before I turn things over to Mayor Taylor, I would like to acknowledge the dignitaries who are joining us this morning. MP Tony Van Bynen, also Don Gallagher Murphy from MPP Christine Elliott's office, and also from the town of Newmarket, Councillor Victor Woodhouse. And lastly, I would like to recognize the board members from the Chamber who are in attendance as well. James Daigle with Tree Frog, and also Shauna Farty with Sun Life Financial. Because time is of the essence, without further ado, Mayor Taylor, I'd like to pass over the Zoom microphone to you. Please go ahead.
Well, thanks very much. And it's great to be here and great to have the Chamber sort of getting us all together to start talking and sharing ideas and thinking through the challenges and opportunities ahead. I'll start by saying this. I'm first of all, Happy New Year. Welcome to 2021. I'm sure many of us are glad to have 2020 behind us. I genuinely mean this. I'm very optimistic and excited about 2021. I think that it's going to be the first couple of months, maybe even 3 months, will be still fairly tough going. But I think that from then on, the environment's going to, both from a business perspective and a health perspective, is going to improve on a monthly basis. And I think we're going to see ourselves moving into good weather, a loosening of restrictions and increased economic opportunities. And I really do believe this. There is a pent-up demand in the community and in society to engage with our business community. And I think our business community is so resilient that I'm predicting, and I really do believe this, and it's somewhat optimistic, but I think we're going to come out of this quicker and stronger than many anticipate. Don't get me wrong, the recovery will be long, but I think it's going to be, it's going to feel very rapid, certainly in the 2021 and the second half of 2021. So I'm very optimistic about it. Of course, the Chamber and the town are here to work with the business community through the entire year and beyond if necessary. But we know there's a lot of heavy lifting to do and there's a lot of challenges still yet ahead. But I really do believe that we're going to have a fantastic year, and the town is very focused on moving the town forward. I've said this before. One of the greatest economic drivers to any community is building a community that people want to live in, that people hear about in other jurisdictions, that people want to start businesses in or grow businesses in, because it's an amazing place to live and do business. And that is one of the greatest economic stimulators you can have. And we will continue to pursue that goal as a council here in Newmarket. So very optimistic. Having said that, I do want to unfortunately remind people of what you probably already know, but the situation we're in related to COVID is still very, very serious. As of yesterday, there were 20 new cases, which is 131 active, which means now Newmarket has over 1,000 cases since its inception, or over 10% of our population, 1% of our population has had COVID. So it's growing. It is growing very rapidly right now. To put it in perspective, just in August, we would have had 0 cases a day, much lower. And another way to put it in perspective is South Lake. In August, September, South Lake would have had maybe 1 person or nobody in ICU and 5 to 8 people in inpatient units. Yesterday, they had 6 people in ICU and 56 people in inpatient units. Even only a month ago, South Lake would have only had 10 or 12 in inpatient, now 56. So there's no question. And I really want to emphasize that. And I know some people on every call, and I respect that, think, oh, the COVID numbers, we hear about it all the time. It's creating fear. But we have to keep that reality in front of us, especially for South Lake. In good times, we said South Lake was our most important asset and one of our most important partners in this community. Well, they are in tough times too. And I think we have to respect the pressure and the stress that institution is under. And so I think we've got to keep that front and center. And the reason I say that is it's the message I've shared many times before. The single greatest thing we can all do for economic recovery is to follow the guidelines as closely as possible, to wear the mask, stay 6 feet, not mix households, et cetera, because that's going to keep the numbers down. And when the numbers are down, the reopenings occur. And so we know that instinctively, and we know that logically. And so I think we really, as a community and a business community, we have to pursue that with vigor, because that's our way out of this. Now, of course, the other way out of this, which is also very exciting, is vaccinations. And I will unabashedly encourage everyone to get the vaccination when it's the appropriate time, or as I've said to people, I will get the vaccination when it's my turn. I'll wait for the vaccination until it's my turn, but when it's my turn, I won't wait. We are in an incredibly fortunate position here in Newmarket. We have the vaccination testing center, or the vaccination center in the senior center right now. Some of you may have heard the town just worked literally in a 3-day period from notification by the province in South Lake on Sunday to myself to yesterday opening up testing at Ray 20 Center, where they're going to have a capacity to do 1,000 tests a day as opposed to 300 previously. So this is a big step forward in the vaccination front. Again, another significant way to move forward is vaccinations. I can assure you that the more the vaccinations roll out quickly, particularly to long-term care, seniors, hospitals, et cetera, but all to the population, the quicker the pressure in the hospital goes down. That's one of our #1 barriers to reopening, or reopening fully. And so the more we can do in that front as well, I would encourage people to do that. Please, for those who are hesitant, have an open mind. I go as far as say, call me and I'll talk to you about why, all the reasons why I believe we should all get vaccinated. But it's really a crucial part of how successful we're going to be in the next 6 months. So, but that's very exciting to have that at our doorstep, and knowing that our residents will have easy access to vaccination, and our frontline workers are already there. I was there the first day they started vaccinating at the senior center, and I can tell you the long-term care workers in particular were there and happy to be there. So moving on then, the town will continue to engage in business supports, of course, working with the business community. I am fairly confident, if not extremely confident, that we will stand up the patio program again. It seems the AGCO is ready to cooperate with that and to support that. And so we look forward to doing that. And perhaps if the environment's better, we can do even more and more creative and more interesting things, not only to support patios, perhaps to support outdoor retail. So let's wait and see what the environment looks like at that time. But our mantra going forward in the town is everything we can to support the business community, and creativity is at the core of that. So we'll be working hand in hand with the chamber to come up with ideas and ways forward to enhance that. And of course, the Shop Local program is going to continue. It wasn't just for Christmas. We're going to have another round of push on that. I'm going to rally some new prizes and try to encourage people to get excited about signing up and shopping local and keeping that that program going as well. The next one on the agenda is literally on the agenda for Monday. I brought forward an idea our staff are looking at and will be in front of council on Monday. That is that the region of York chose to not increase water and wastewater rates in 2021 out of respect for the COVID environment. that would reduce the average property water bill by about $20–30 for the year, or $2 or $3 a month. So I would make the contention that that is not going to meaningfully impact anybody in a positive way. And furthermore, I would contend that the majority of homeowners are not the ones who are in need of the greatest level of help. In fact, I would contend, perhaps unpopularly, but that the majority of, at least a 50% majority of homeowners are potentially in a better place economically than they were pre-COVID. That's the unfortunate inequality of COVID. Many of those people, if you look at the data, shows that they were able to continue to work from home and receive full income, while having fewer expenditures. That speaks to the increased savings that you're seeing across the country. So the reason I say that is because I believe that what we should do is not reduce the residential residential water rate for across the town. I think that isn't significant enough. But what we can do, and what was going to be proposed at the meeting, is that we can take that and target it on the small business community. So anybody with a 2-inch water pipe, which is indicative of a small business, could receive up to as high as a $1,000 reduction for the year, or a $100, close to $100 per month, which I believe is meaningful relief and significant support, and particularly targeted at the business community. Again, unlike my comment on the hospital earlier, we've heard everybody say, we're here to support our business community. We'll do anything we can. We'll shop local. We'll do curbside pickup, whatever it takes. Well, what I'm asking the community to do is forego their $20 and let us direct it to the business community and the small business community in particular. It's not that there isn't bigger businesses that need support and relief, but the kind of support and relief they need isn't going to be impactful enough from a measure like this. They're going to be looking to larger provincial, federal programs, as is others. But this kind of break on their water bill and the size of their water bill would be relatively inconsequential. And so I think, again, target it where it's meaningful. It's not going to be meaningful at the really big business end. It's not going to be meaningful at the residential end. Small business is where we can direct it and with the most impact. So that'll be on the agenda for Monday. So, finally, I'm trying to move quickly because I want to leave as much time for questions and answers as well. But we've got a lot to do in the first quarter. We're like yourselves, we're very busy here at the town trying to pivot and trying to come up with ways to make sure there's outdoor recreational opportunities, make sure that we can support South Lake, make sure that we're adjusting our business practices accordingly. And one of those is being focused on supporting the business community. And the final area there, I will again unabashedly say that we will pursue, which is this, that I would suggest that every person on this call, maybe not one, but probably every person on this call, are following the guidelines and frankly the laws of the land related to COVID. Whether we agree 100% with each measure or each law or not, we're in this together. We at the region felt originally that we didn't necessarily need to move into lockdown at that time, but the province moved us into lockdown. And my position from the second they do that on is I support the province and I support the measures, because the more we work together to support the moment we're in, the quicker we can get out of it. Division and dissent doesn't work. And frankly, that means that as a region and as a town, anyone who is not adhering to the guidelines, we will pursue penalties with them. We will apply that. And that's out of respect for all of you whose businesses are struggling or suffering. And you're doing what is right and you're following the rules and the guidelines. We can't let people who are not do that. And so I will let you know that yesterday, a business in the town of Newmarket, I believe that only the second to Adamson's Barbecue in Toronto, was refusing to close. A very rare Section 22 order was issued in conjunction with bylaws of the town of Newmarket, but by our medical officer of health. And that is in process right now. That can be a forced closure. This business is not wearing masks, refusing to close, taking in customers 4 at a time, 5 at a time, 6 at a time. It's, in my opinion, a protest movement. And I will say this, you're entitled to not agree with measures. You're entitled to protest them. You're entitled to voice your opinion online or elsewhere, form organizations, lobby, try to get the rules changed. But it is not an option in our society to ignore the law and to choose to do what you would like to do. And it's a very distant parallel, but it's not one without meaning. What we saw and witnessed yesterday in the United States of America was disheartening and outrageous. And it was an example of people believing that they can decide what the law is for themselves. And we can't have that in the middle of a pandemic. And so, again, we will, as a business, not only as a health measure, but as a business support measure, we will pursue the regulations of the law fully, because it's right for every business owner in this community that is doing, and that's 99% or 99.9% that are doing the right thing, that we do that. And so I don't want to end on that note because it's a bit heavy, but again, I want to pivot back to my starting point. I think it's going to be an outstanding year. I will admittedly say I think the first 2 or 3 months are going to be a little bit tough, or a lot tough. The chambers here and the town is here to work with the business community and the community at large to try to make this as palatable as possible. The federal governments, the provincial governments are doing incredible things to support our communities and our businesses as well. We are resilient, we're strong. We've proven that through 2020. I look back with an immense amount of pride what this community did, what the chamber did, what the business community did, the ingenuity, the creativity, and as tough as it is, it's incredible what we're doing, and we will look back with a great deal of pride on this. We won't look back wanting to revisit it. We won't look back enjoying it, but we will look back with pride. And so we've got a few more months, I believe, and I hope I'm correct, at the most of tough sledding, but we're going to get through it. And I think from then on, we're going to see every month get better and stronger. And we will be, I hope, enjoying full activities. My personal dream or goal is that we have one of the outdoor concerts at Riverwalk in the late summer. If we can get to that point, that we can achieve the kind of numbers we need and the conditions we need, and that would be a sign to me of the community opening up and business flowing and us being virtually back to normal. That's an ambitious goal, but that's the one in my mind I hope we can achieve, and that will be done through a collective effort of the citizens and the businesses of this town. So I thank you all for everything you've done so far. I watch it, I witness it, I follow on social media. This is an incredible community and an incredible business community, and just really thank you for everything you're doing. Thanks.
Excellent. Thank you very much, Mayor Taylor. Thank you. Dr. Genesov, can I pass it over to you?
Thank you. Okay, I'm just going to share my screen. Okay, there we go. So thank you very much. So my name's Dr. Leon Genesov. I'm a physician with York Region Public Health, and thank you for inviting me to participate today. And I'm joined by my colleague, Zara Kassam. Zara is the Director of Healthy Living with York Region Public Health, and she's currently leading the COVID-19 vaccine operations in our Health Emergency Operations Center.
Good morning, everyone.
There we go. Okay. One more. So our team of dedicated public health professionals at York Region Public Health remain committed to all aspects of the COVID-19 response, including case management and contact tracing activities, as well as outbreak management, including workplace outbreaks, and a role in the distribution and administration of the vaccine, which my colleague Zara will touch on shortly. So we only have a limited amount of time with you today, so I encourage you to visit our website at york.ca/COVID-19 for information on COVID-19 in York Region. You'll see on that page a series of tiles, and you can click on that tiles for specific information about workplaces, schools, the data, and various other information that will be helpful to you. And also encourage everyone to watch Dr. Kurji's weekly video update on every Monday. Dr. Kurji is our medical officer of health, and he gives a weekly update every Monday on video. And there's a lot of excellent and very important information in that video. Now, let's see. Okay, going on. So, one moment. Okay. All right, so as you're all aware, COVID-19 cases continue to rise in the province and in York Region. And on December 26th, the Ontario government implemented a province-wide shutdown. The province-wide shutdown is lasting until January the 9th. And public health regions in Southern Ontario will remain in shutdown until January 23rd. So that, as we heard from the mayor, was the decision made by the province. So the following public health safety measures are applicable to gatherings, all gatherings, to workplaces, and to face coverings. I won't go through them all as they're on the slide, and I'm sure you're familiar with all of them at this point. I'll just cover a few of them. So trips outside of the home should only be for essential reasons: work, school, groceries, pharmacy, healthcare, assisting the vulnerable in our population, and exercise and physical activity. Physical distancing, as we heard from the mayor, physical distancing has to be maintained for individuals outside of one's household. And where possible, if it's possible, it's not easy, but if it's possible to work remotely, please try and do that. Every workplace is required to screen all employees at the start of each day or each shift. And there's a template for that posted on ontario.ca. Employers are also required to have a workplace safety plan. And as we've heard, face coverings are required in all indoor public spaces with limited exemptions. So this includes, in terms of where it applies, where face coverings are required, indoor workplaces and outdoors when physical distancing cannot be maintained, or if wearing a face covering is required by law. And then worker protections such as personal protective equipment, including masks and eye protection, are required when we have where patrons without face coverings are within 2 meters of workers. So you're talking about indoors, in businesses indoors, and in the absence of a plexiglass or some other impermeable barrier. Again, non-essential travel, this has been in the news, non-essential travel from areas of high transmission to areas of low transmission should be avoided. And businesses and any other workplaces that are open, any places that are open, and you have your workers there, you're required to ensure that equipment, washrooms, locker rooms, change rooms, and showers for workers are cleaned and disinfected as frequently and as is necessary to maintain a sanitary condition. So as we've heard, York Region continues to follow the provincial lead with respect to reopening businesses and public spaces. At the end of the province-wide shutdown period, whenever that's going to end, in case it's extended, but when that ends, the COVID-19 response framework, keeping Ontario safe and open, will come into place again. So while the data continues to be monitored weekly by public health, the provincial chief medical officer of health, Dr. Williams, will review trends in key public health indicators in the final week of the province-wide shutdown period. And the indicators for each public health region in Ontario, each public health unit region will be assessed to determine the appropriate zones under the framework when the lockdown is lifted. And more information and details about the shutdown is available on the province website, ontario.ca. So just a little bit about understanding COVID-19 regulations. As you know, as we've heard, businesses, and thank you, Mayor, businesses have a responsibility to have procedures and policies in place to prevent the transmission of COVID-19. Remote work where possible should happen to the greatest extent possible. And then you can find sector-specific health and safety guidelines for workplaces and signages to keep workers, customers, and the general public safe at the Preventing COVID-19 in the Workplace tile on york.ca/COVID-19 or york.ca/prevent COVID-19 at work. And briefly, the mayor touched on this a little bit. I'll talk about the COVID-19 economic impact recovery measures. So York Region is committed to working, collaborating with all levels of government to implement economic recovery measures. Both the Government of Canada and the Government of Ontario have dedicated resources to ensuring our economy remains as strong as possible. And York Region Council has approved the establishment of a business recovery support partnership to help businesses affected by COVID-19 restrictions. The task force that was set up addresses immediate and long-term economic recovery strategies and supports for the York Region business community. Businesses impacted by the province-wide shutdown are eligible for Ontario Small Business Support Grants, and the province is expected to announce details of this grant shortly. For more information on what supports are available to businesses, you'd like to visit yorklink.ca/COVID-19. That's yorklink.ca/COVID-19. Okay, so thank you for that. Now I'll turn over to my colleague Zara to provide some information on the COVID-19 vaccine.
Thank you so much. So it's exciting news about the vaccine that's arrived in Canada. So in terms of what's been happening, the Ontario government is continuing the rollout of phase 1 of its vaccine implementation plan by ensuring that all residents, healthcare workers, and essential caregivers at long-term care homes and retirement homes in the priority regions of Toronto, Peel, York, and Windsor, Essex receive a COVID vaccine 19 vaccination by January 21st, 2021. And the government's vaccine rollout is well underway since launching in December. On December 9th, 2020, Health Canada approved the first COVID-19 vaccine in Canada manufactured by Pfizer. And on December 23rd, approved the COVID-19 vaccine manufactured by Moderna. So both the Pfizer and Moderna vaccine are messenger RNA or mRNA vaccines. And these vaccines teach our cells how to make a protein that will trigger an immune response without using the live virus that causes COVID-19. Once triggered, our bodies then make antibodies, and these antibodies help us fight the infection if the real virus does enter our body in the future. So Health Canada approved the vaccines after independent and thorough scientific reviews for safety, effectiveness, and quality. Health Canada will continue to monitor the safety and effectiveness of the vaccine. Ontario received 95,000 doses of the Pfizer vaccine by December 21st, with regular weekly shipments of Pfizer vaccine expected starting January 2021. Additional delivery sites will be offering the vaccine to key populations by the end of January. So COVID-19 immunizations, as I mentioned, are underway for residents, healthcare workers, and essential caregivers within long-term care homes in York Region. So this is very exciting and a hopeful step towards fighting the fight against COVID-19. For York Region Public Health, we have a lot of experience with vaccines from storage to distribution, administration, and clinic setup. We are working very closely with our health system partners on the rollout and administration of the vaccine, including the Province of Ontario, the Ministry of Health, Ontario Health, our local hospitals, local long-term care and retirement homes, and other groups such as York Regional Police and York Region Paramedics. So in York Region, we have 28 long-term care homes and approximately 3,700 residents who will imminently have access to these life-saving vaccines. And that rollout already started last weekend. Vaccines will be administered on a priority basis and in consideration of resources and readiness of each individual home, ultimately making their way to all long-term care facilities. Residents, healthcare workers, and essential caregivers of long-term care homes are appropriately prioritized to be among the first individuals to receive the COVID-19 vaccine. And we are also reaching out to retirement homes to prepare for resident and staff vaccinations in these locations. Healthcare workers and staff of long-term care facilities and retirement homes are being offered the Pfizer vaccine through provincially selected hospital sites or the Moderna vaccine at their long-term care location. In York Region, we have 2 hospital sites currently running vaccination clinics, South Lake Regional Health Center in the town of Newmarket and Mackenzie Health in the city of Vaughan. We are optimistic the arrival of vaccines and rollout of the provincial immunization programs will be a hopeful step in protecting and saving the lives of some of our most vulnerable residents. So as a reminder, even as vaccinations begin in Ontario, we must continue to persevere and follow public health measures to keep everyone safe and healthy. Do not host or attend social gatherings, practice physical distancing, wear a mask when required, and wash your hands frequently. In terms of vaccinating the general public, the approval of 2 safe and effective vaccines with more potential options on the way give us hope and remind us better days are ahead. So York Region Public Health is working diligently with all healthcare partners and under the guidance of the provincial immunization rollout plan to bring the vaccine to our community as rapidly as possible. The Canadian government anticipates vaccines will be available for widespread public use as early as this spring. A COVID-19 vaccine will be available for free for anyone who wishes to receive one, with plans to complete Canadian vaccinations by the end of 2021. The COVID-19 vaccine is voluntarily but highly encouraged for those who are eligible, not only for personal protection, but for the safety and well-being of others. Vaccination is one of the most effective ways to prevent the spread and reduce the impact of infectious diseases, whether it's seasonal flu or childhood infections. York Region Public Health will continue to provide official information and updates for the public as this immunization program develops. And in December, we launched a page on our website specifically for COVID-19 vaccination information at york.ca/COVID-19 vaccine. So just turn it back over to Leon.
Thank you, Zara. Okay. So the conclusions and reminders. So even as vaccinations begin in Ontario, we must continue to persevere and follow the public health measures. So we know we're all tired of the measures, but we must remain vigilant and apply the measures. Please, as we heard from the mayor, limit your trips outside your home to necessities, getting food, getting medication, going to medical appointments, supporting vulnerable members of the community, going out for childcare, or going out for exercise, or walking pets with the people that you live with. But please also always stay at home if you have symptoms, even if they're mild. It's really important if you have any symptoms at all to stay home. Stay 2 meters apart from people you don't live with, and wear a face mask or face covering in indoor public spaces or any time that physical distancing is not possible. And again, for more information, visit york.ca/COVID-19. So thank you. So I know this, we don't have a lot of time for questions. And it's very difficult to answer specific questions about specific businesses. But in addition to the support provided by the Newmarket Chamber of Commerce, if you want to speak to York Region Public Health or any of the programs in York Region, you can contact York Region through Access York, Monday to Friday, at the phone number on the screen, and by email at accessyork@york.ca. Okay, thank you. And then we've got, let's see, a few minutes, about 5 or 6 minutes for questions related to York Region Public. Thank you.
Okay, so I'm seeing a lot of questions coming up, and I know we only have a short time. So if you've put them in the chat, we will get you those answers afterwards. I know that Mayor Taylor has to leave now. There was a couple of questions that he did want to address that we've seen come up in the chat. So Mayor Taylor, I'll just quickly have you respond to those questions.
Yeah, thank you, Tracy. I have about 7 minutes. I'll be quick on some of the questions. So first of all, I want to say that it was asked about, and I'm trying to see the wording on it, but it was asked about business closures. Where is it?
Here, I can quickly paraphrase.
Oh, do you feel that with the businesses closed and the numbers still rising, that closing businesses is effective? First of all, I want to say this, it's a very hard to find the balance, whether it's the decisions we're making at the region, certainly the province, to find those balances. We know that in some cases, some businesses are hot spots. Meatpacking plants, large manufacturing, et cetera, can be producing large numbers of cases. But many of those are open. So this is a tough question. We've struggled with this at the region. Dr. Kurji has indicated that he is not convinced that the difference between red and full lockdown has a meaningful difference in terms of COVID numbers. But he also will admit that that's very debatable, and it's hard to get the exact data to prove it one way or another. The province has access to much greater amounts of data and various experts, and they're making some very difficult decisions. I will say this. I'm going from here to a meeting with the small urban mayors of the GTA in a minute. And the large urban mayors are meeting this afternoon as well. And I've been talking with some of those representatives. I think that still, generally speaking, at least in York Region, we would like to have a conversation with the province, and we have one, it's an ongoing conversation, but we'll continue to have that conversation about whether whether red modified or lockdown modified can be a next step. In other words, I think at the end of 28 days, there are ways to keep all of the safety measures in place as the benefits we glean from a red or a lockdown, while still allowing some greater flexibility to business to frankly create revenue and generate revenue, and really would like the opportunity to continue to have that conversation. And one example I'll give you is I believe by appointment only shopping in store is something that could be done very safely and could be one small step towards greater revenue streams. That's just one example, and I wouldn't pretend to have all the answers. I think it's something we need to explore more fully. But with the numbers where they are, and with the guidelines the province has provided previously, meeting those targets in the next short term would seem impossible. And given that it would seem unlikely we're going to meet those targets in the next month to 2 months, I think we need to explore what we can do to maintain all of the positive benefits of restrictions on keeping COVID numbers down, while exploring creative opportunities that are low risk to provide businesses with some more opportunities. I know that's vague, but that's because we need to do this in partnership with other levels of government, and we need to, truly establish which of those opportunities could be pursued more fully. And there was also a question about big box stores. Again, I'm not privy to all the information that the province has, but it's my feeling that we should be treating big box stores much like they do out west, which is that they're open only for the essential business products that their competitors are allowed to, but not beyond that. I would, and I've said this before, but I would like to see us eventually take that step, and the sooner the better, frankly, because I think that's a significant competitive advantage when they can sell products that smaller businesses can't sell because they're closed. And if it's not essential for small business to sell them, then it's not essential for big box stores to sell them. So if a big box store is open to sell groceries or medical supplies or some other essential product, fine, but everything else should be cordoned off, in my opinion. But again, I want to be clear, these are very difficult decisions. We've made some at the regional level and at municipal level, and they're very hard to find the right balance. I respect what the province is going through. They're making very difficult decisions. The Premier, our Minister of Health, they're dealing with very significant challenges, and getting everything perfect is not even on the table. We'll never, for those of you who say, oh, this doesn't make sense compared to that, when this is over, there will never be a perfect consistency of logic throughout, because it's just so hard to achieve. And so I just really want to say I respect the tough decisions they're making. And I will say this again, I want to reiterate, whatever decisions are made, I will follow them and support them, because we're in this together, and we will only make progress together, not by picking and choosing individually or having different positions at one level of government to another. So we will input and we will try to influence, but when the decision is made, that's the decision, and I support it.
Thanks, Mayor Taylor. And I know that Dr. Genesov also has to leave. So I'm just wondering, Dr. Genesov, if you can weigh in on your thoughts around the business closures, but as well, we saw some more stringent guidelines come across in Quebec. And I'm wondering if you can just give a thought whether you think we'll see something here tightening up.
Yeah, it's a good question. So I think, the general direction from the specific direction on further restrictions comes from the province. So, we've just heard in the media that we'll be hearing in the near future what the province thinks of the current situation, and looking at what's going on in Quebec also. I think, as Mayor Taylor said, we want to balance keeping people safe and keeping businesses open, going and viable, and being able to serve their customers and patrons.
So some of the questions we're seeing around vaccinations, we were asked whether or not large employers in town could have vaccinations done in-house in any way, like they used to do the flu shot and some of the other pieces. Is that a consideration for our really large employers in town?
So we have to kind of take that back and look at it, because the other piece is the transportability of the vaccine is still being explored. So we're just understanding that we may be able to transport the vaccine in an unfrozen state. It's a very fragile vaccine. So up till now, we've had to transport it frozen, and there's issues around ensuring that it's stored well. So there's a lot to consider. What I would say is that from a mass immunization perspective for the community, we're looking to establish a hybrid model of sites where it would be accessible to the public, looking at fixed sites, possible drive-through options where we also piloted the flu vaccine through drive-through, where you're in your car at Ray 20, you come up and the nurse gives you your needle in your arm and then you pull up for some observation. So we're looking at various options that would allow individuals to get to and have the hours that are open for individuals to get to as well. But we will take that back.
And when do you anticipate that the vaccine would be available to the general public? Because I know obviously we're concentrating on first responders and long-term care, which makes sense.
So it really depends on the availability, but I can tell you that from what we've been discussing with the ministry, it could be as early as April. So we are getting ourselves and ready, and we've been planning for many, many months in anticipation of this.
Perfect. There was one question that came up and I wasn't sure if it was answered. If someone has had the vaccine, can they still transmit the virus? That's the question.
So I believe that so the efficiency or the effectiveness of the vaccine is really secured after 2 doses. And so at this point, I believe that they can't, but I would want to just not be affirmative about that because I know they're still looking at the long-term effectiveness, but it's quite effective, especially after the second dose. And then I don't know if Leon, if you have anything to add from a medical perspective.
Right. So so that's a very good question. So in terms of the effectiveness, it's known in terms of the effectiveness has been studied in the studies that led to the approvals of the vaccine. Studies relate to the prevention of COVID disease and COVID symptoms. There's still a lot of research that has to be done related to transmissibility of the virus from people that have been vaccinated. That's why it's very important that these studies continue on as people get vaccinated.
Dr. Geneso, and we're getting a lot of questions around the study and whether the information will be released, or is there a way to access that?
There's a lot of information on Canada.ca, and Health Canada has provided a lot of information about the vaccines on the Canada.ca website, and all the work that Pfizer and Moderna have done. And Pfizer and Moderna have also posted their monographs on their the websites. So there's the whole range of information there. So you start looking at the vaccine information on the Health Canada website. The tracing like we've done before, so we can email some specific links and questions to afterwards.
That would be great. What role do you feel is the role of businesses and the chamber, for example, in educating or alleviating hesitancy in terms of people getting the vaccine?
Being supportive and helping my colleague Zara with the rollout of the vaccine campaign. There's a lot of good information from the province about the vaccine and who should get it. Again, it's a voluntary vaccine. Everybody has to make their own decision, but it's been reviewed by Health Canada and other authorities in terms of safety. So it's the leadership, as we've heard from the mayor, waiting for our turn, and then as soon as it's our turn, getting the vaccine and supporting the rollout measures. It's a immense logistical undertaking to roll out the vaccine. As we've heard, the storage requirements, the transportation requirements are very complicated, and I think getting it into people's arms is quite a logistical feat. So all the support you can provide is going to be very welcome.
So I'm sorry, but I think we need to come off this call because we have another one right now. But
Right.
thank
Yeah.
you for your time.
No problem. Thank you for joining us, and we'll look for those links and we'll share those out.
Okay,
Thank you.
thanks. Take care, Ryan.
Thanks.
Bye.
Bye. Thanks. I will now turn it over, actually, now that Tony Van Bynen has joined us, just for a quick update from our MP. And there was also a question, Tony, that I'll direct at you, a question about any idea when other vaccine suppliers may have their vaccines approved, for example, AstraZeneca. So with that note, I'll throw you the question and turn over the mic to you.
Great, thanks very much, Tracy. Well, first and foremost, I'm glad to see that the federal government is committing to covering the cost of all of the vaccines and the supplies that's needed to distribute them, so that every Canadian has access to the vaccine free of charge. We do have the most diverse portfolio of vaccines, and we have commitments for the highest per capita level of vaccines than anywhere else in the world. Two of the vaccines are in place, and I believe an additional 5 are under consideration. The timing for that has to depend on the research and on more technical matters that I can't speak to. But the fact that we have already made available close to 400 or 500,000 vaccines and project to have 1.2 million vaccinations available by the end of January is encouraging. But at the same time, we're not giving up the pursuit of the other options. We have a very huge population, and 1.2 million is just the beginning. So there's a very significant job ahead of us, number one, and it reemphasizes the fact that we have to listen to what's being advised as far as our healthcare protections, like keep your distance, wash your hands, stay at home when you can and you need to. So from the medical point of view, I can give you a better update if I can check in and get an update from the minister's department. But I'm quite optimistic in terms of where we stand and the continuing commitment to develop other products to make sure that we are able to get the vaccination out, and again, to meet the targets that you've heard about earlier. So that's important. On a positive note, and first, I don't want to take away from the importance of the vaccine. That's critical. I think we'll never see an economic recovery or a turnaround until we get on top of this pandemic, and that's really critical. So that's first and foremost a priority for us. We've all heard the fiscal update from the Minister of Finance, and in that there was the commitment to provide up to 3% of the GDP, or $100 billion over a 3-year program, as part of the revitalization or the economic recovery plan. Now, the good news is, and I don't know if many of you take the opportunity to look at the website for the PBO, Parliamentary Budget Officer. I've sat in on a couple of seminars with him, and he's saying that our economy has the ability to sustain up to 2 years of the supports that we have, and so it's critical that we get on top of this vaccine before we get into the in and past the 2-year cycle. And in addition to that, he's done an independent analysis, and as you know, that's a nonpartisan position, the PBO's office. And his independent analysis is that, based on what he sees, the economic stimulus is probably will only be required for 1 rather than 3 years. And so I think that speaks to what we heard earlier from the mayor, and that is that the recovery and the rebound will be fairly significant early on in the early stages. So from a financial support point of view, I'm sure the chamber has advised their members of all of the programs that are available in terms of the support programs, the wage subsidy, et cetera, and those will continue on, I think, through until June. And if anybody needs any more details, feel free to give our office a call. On a positive note, happy Orthodox Christmas Day today for anyone who's celebrating that. And at the same time, today starts the year where we're increasing the basic personal deduction amount for income tax purposes. And what that means is that as many as 4.3 million Canadians, mostly seniors, will probably see a reduction in their personal income tax, and 465,000 seniors will be in a position where they'll not need to pay taxes this year. So, there are some programs in the longer term that are going to provide some additional economic support and make money available for purchases and supporting our local businesses. On my own part, I have my weekly rounds of visiting local restaurants on the pickup route, and I'm doing personally everything I can to support local business. I think that's important, and I want to continue to say that if there's any way that our office can help, feel free to give us a call, and we can post that. And I know, Tracy, your office has our number, and we're certainly quite eager to work with you.
We have it on speed dial. There's there's a question. I want to get to Don Gallagher Murphy for an update, but there is a question for you. Oh, there's another one that's just popped up, but Canada's listed as second from the bottom globally in terms of the distribution. And while we appreciate it's a huge logistic issue to distribute the vaccine, what do you think is the main issue in terms of Canada improving that?
Well, being on the health committee, I've discovered, the complexity of the multiple layers of government. Number one, when we're looking at federal, provincial, regional, and local, and then in hospital boards as well. But let's not lose sight of the fact that Canada is a very diverse and complex country. We've got a huge land mass. We have a lot of situations that are critical where we need to prioritize isolated communities. We've needed to respond to some very critical needs in terms of accommodations for seniors, and some of those priorities need to be properly addressed first as we go forward. There's a continuing commitment at all levels of government to move as quickly as we can, and I think we need to understand the diversity of our country and the geography and the support structures that we have.
The other questions that's coming through, you're popular today, is in terms of the rent relief grant, is there a known delay that you're aware of? A number of small businesses have submitted their applications and haven't received any answer yet. And the website says 10 to 15 days in terms of hearing back.
I'm not aware of any systemic setbacks. So maybe what we could do is for those individuals who haven't received a response to give our office a call. I should give you the number 905-953-7515, and we'd be happy to pursue those specific situations. But I'll check in with the office, and if there is anything that's being missed, or if there are any general or common concerns or common errors that are surfacing, we'll get them back to you. Okay, Tracy? Okay,
thanks, Tony. And if you don't mind just putting that number in the chat so people have it.
Sure.
Thank you. And I'm going to move to Don Gallagher Murphy from Minister Elliott's office for a quick update. Don?
Good morning and Happy New Year to everybody. I think between the mayor and York Region, they've talked a lot about some of the provincial things going on. The items I would add at this point, if people have not heard, yesterday the Premier and our Deputy Premier, Christine Elliott, announced at the airport that there is a new innovative, voluntary and free test that will happen at the border when people arrive. So this is something that I'm hoping will be a very positive thing and help prevent some of that COVID that could be coming in from the airport. So that's number one. So that in addition to what the feds are doing with the mandate test, hopefully both of that will control that. Other than that, the vaccine is the big item right now. And I'm happy that over 60,000 vaccinations have been provided. And I believe we're up to almost 1,000 totally completed. So that's the 2 shots. So that's good. We're on our way there. Other things, only a side note, which I think is interesting, that has come up. Yesterday, it was announced, and it gets buried in some of these other things related to COVID, but the Ministry of the Attorney General announced that alcohol sales, specifically wine, will be allowed to be sold in farmers markets. So if you're in that kind of area of business, I think that's a positive there, and an opportunity, of course. I think those are my only ones at this point, Tracy.
Thank you. And Dawn, I'm not sure if this is a question for you or for MP Van Bynen, but in terms of initiatives around tracking and tracing, I know there's the COVID app, but it's not being adopted as well as people, I guess, as well as we had hoped, despite the promotions around it. Are there other initiatives being looked at in terms of pushing the tracking and tracing? Because that will certainly help businesses open up if we can do better in those areas, and more initiatives around specific contact tracing issues.
Well, from a provincial standpoint, because I know a lot of that just stems from the province, I have not heard of anything further except for pushing people to utilize the COVID alert. And if we're all using the COVID alert, I've heard some good news from people who have been using it, and they go get their tests and, you know, it's negative, which has been very positive. I don't know anybody who's got a positive from it. But that is one of the things that the province is also pushing for, please people to utilize the COVID alert.
Tracy, you know, this might be a good opportunity for us to maybe put together a challenge amongst the chambers and maybe different municipalities. You know, we had the you know, the ice bucket challenge, maybe the COVID challenge, and it's just a matter of communications, a matter of creating the awareness and promoting that. So that might be something we can give some consideration to. And with social media, of course, it's an opportunity for us to do it at a very, very low cost. So there may be some challenges. Let's see if we can get something like that started. The other thing I'd forgotten to mention earlier is that we had just recently been able to announce some direct funding under the Safe Restart program, which of course is funded 50-50 by the federal government and the province. I don't know if many people are aware, but we did announce that $549,000 was paid directly to the town of Aurora to help cover some of their operating shortfalls and diminish or reduce some of the operating costs and of course the tax burden. But at the same time, there was $769,000 paid directly over to the town of Newmarket, and $9,921,000 from the Safe Restart program that was funded into those municipalities. So in part, that indirectly provides some tax relief for some of those programs. So it's great to see that partnership working extremely well.
All right. One last question that's come up on the side here from Pete Basso. When will the promises made in the fall economic statement reiterated in December get rolled out? For example, the $2.6 billion for home efficiency upgrades, et cetera. So that's a question on some of the green initiatives.
Yeah, well, there's an ongoing commitment to make sure, and some of those have budgetary implications, and so understanding when that can be going forward, we fully be we will fully be operating by the last week in January and bringing those measures forward. How that will be implemented, I think, will be key. I've actually taken the opportunity of advancing a project that was brought forward by the Newmarket Chamber in the town of Newmarket called the NEAR program, Newmarket Energy Efficiency Retrofit Program. And I've asked the ministry to take a look at that because it's a perfect fit. And there's been a direct discussion with the Minister of the Environment to take a look at that project. That's a project I think that can have a significant impact as a social enterprise, number one, but number two, it's got some very significant GHG reduction benefits, and it's one that could work very well in partnership with the municipality. The challenge is startup money, and as I say, that the proposal is in front of the Minister of the Environment for consideration in terms of A, gaining a better understanding, and B, to see if there's any funding options that are available. But that's a program that I think is exciting. It's been going for about 3 or 4 years. It's just, all it needs is some cash to get started, and so I think that's something that I'm optimistic about.
Great, thanks. I know we had wanted to do an update, but I think in terms of advocacy from ABDIS, but I think pretty much everything was covered off here between all levels of government. So I want to thank everyone for joining us. There are a couple of things coming up with the Chamber. Our Business Thrives Conference is February 2nd and 4th. That one's coming up quick. We're getting as much information up as we can on our website. It's in cooperation with York University, Schulich Business. Jeff McInnes, who's a world Olympian and world explorer, will be our host. And there's a number of keynote speakers, and we're really looking at resiliency and moving forward beyond recovery. So that's an exciting one. And our women's event will be coming up March 9th. So lots of things going on. Just visit newmarketchamber.ca and you'll find all those pieces there. So thanks again for joining us. And if we didn't get to your questions, we'll review that and try to get you those answers or reach out to us. So Happy New Year again, and thanks everyone.
Yeah.
Thank you.
Happy New Year.
Thank you.
Thanks.